2 months ago, I was waiting anxiously at the hospital for my husband to come out of heart surgery. He was having the procedure after being diagnosed last year with a stroke. Now, we don't know when he had the stroke, but we now know what likely caused it. And he was among the first to have a minimally invasive procedure at Baptist Medical Center Jacksonville to fix the problem.
Basically, I wore a bag over my head for about 4 years because I could not explain to anyone what was going on with me.
It was a freak accident last year that started us down the path to getting answers. My husband, Michael, hit his head as he was getting out of his truck. A few days later, with signs of a concussion, we went to the ER where he had a scan of his brain.
And the ER doctor came back and said, "Have you had a stroke?" And I was like, "No, I have no idea what you're talking about."
Confused and scared, we went to endovascular neurosurgeon Dr. Ricardo Hanel.
Clearly there was a stroke in what we call the right parietal area of the brain.
Dr. Hanel, the director of Baptist Neurological Institute, told us that Michael had had a silent stroke.
You can see people having trouble with worsening of short-term memory, and other symptoms are more vague. So if somebody has a small stroke on that area, they might not even realize they had a stroke.
Just 40 years old and the father of our 2 young children, Michael was sent for a series of tests to figure out why he had a stroke.
It's very important to question your physician, am I doing all the tests that needs to be done for a stroke in the young?
All of the tests came back negative until cardiologist Dr. Pamela Rama guided a probe down his throat to get an up-close look at his heart. And that is when we got answers.
They picked up that I had a large hole in my heart, it's a PFO.
The hole in his heart was congenital, and despite numerous echocardiograms over his life, it had never been discovered.
There was always something going on with my heart that didn't make sense. I knew it in my gut, but they all missed it.
We were sent to interventional cardiologist Dr. Ruby Sapathi. She told us about 25% of people have a hole in their heart, but not all need to be closed. In Michael's case, however, if he did not have surgery to close the hole, he was at a very high risk for having another stroke.
There are two options: one, open heart surgery, closing the hole like putting a patch on, what we have done historically for 30 years, and it's a big major surgery. The other option is closing with a catheter, which is what I do.
We opted for a minimally invasive, hour-long surgery, no anesthesia, a 3-day recovery, and only 1 night in the hospital.
I'm doing well. I was surprised at the results.
During surgery, another surprise. It turned out Michael had 3 holes in his heart.
After this long, painful journey, finally I figure out, aha, not one aha, but in this case, 4 ahas, because 3 holes in a stroke could be the name of a band.
Using a catheter and going through his groin, Dr. Sapathi implanted a small metal mesh device like this one in his heart to close all 3 holes.
You can see it if I pull it. You can actually make it straight like that. This is what I'm doing here.
While the procedure has been performed on children for several years, Michael was only the 2nd adult to have it performed at Baptist Medical Center Jacksonville. And just hours after the surgery, he was sitting up and eating, and the next day, able to walk out of the hospital and go home.
I'm lucky to be alive. I have to keep thinking about that in my mind and press on, but I will forever wonder what is me versus what is the stroke. There's so many people in this position that have some mysterious disease. Now, I'm living proof. I mean, there's some pretty significant things going on, and yet somehow those are overlooked.
Now, medical technology really has come so far, and closing a hole in the heart is not the only procedure that can be done with a catheter. Dr. Sapathi is also doing transcatheter procedures for a number of heart conditions, including replacing aortic valves and also repairing mitral valves. Some of those procedures are also available at other local hospitals. And we have a lot more information for you online at firstcoastnews.com. And I'm very happy to report my husband is doing great, and we really are so thankful for his amazing team of doctors.
Wow.
Yeah, what a remarkable story.
Amazing.
A story of clearly timing and hope, faith,
absolutely.
and the skills of the physician.
Absolutely. We credit them with saving his life.
And now 3 holes in a stroke sounds like a good band, good band to me too. Let's strike up the band. Let's take a look. It is